Buenos días a todos. Antes de comenzar, quiero
Morning,
compartir con
everyone.
ustedes
Before
unas
we
breves
start, I want to share a
instrucciones
couple of instructions on the use of simultaneous interpretation for this webinar. The presentations
en
will
idioma
be done
original,
in
pero también
Spanish,
para
but we will
interpretación
have
simultánea en inglés y
interpretation
portugués
into
durante
English
todo el
and
evento.
Portuguese.
Para seleccionar el idioma de
And for all
interpretación,
sessions, to
ingresen
select
al
your
menú
language, go to the
inferior de su
bottom
pantalla y hagan clic
menu
en el
of your
icono que
screen
recuerda
and
el
click on the
globo.
globe, and
Deseamos
then you
desplegar
will
el
have the
icono de su
options of the languages
idioma
available:
inglés y
Spanish,
portugués.
English, and
Now I'm
Portuguese.
going to repeat this part in English just in case someone need it. The presentation will be conducted in Spanish, but simultaneous interpretation into English and Portuguese will be available throughout the session. To select your preferred language, go to the bottom menu of your screen and click the globe icon. Once clicked, the available language options will be displayed: Spanish, English, and Portuguese. Para una mejor calidad del
For
sonido,
better audio
recomiendo
quality, please
seleccionar
select the option
Silenciar audio original
Mute
en este
original audio
momento
if
en un
you
idioma distinto al idioma
choose
original
a
que esté
different
utilizando el
language
resto de
than the
panelistas.
one that is being used by the
Después de
panelists. This
realizar
will allow you
esta
to
demostración,
enjoy a more clear
para dar inicio a
transmission.
nuestro evento, le doy la palabra a Janet
And
Jihad,
now I hand the floor to Janet
para
Jihad,
que nos dé la
Executive Director of
bienvenida.
FIFARMA, for the welcoming remarks.
Muchas gracias,
Thank you
María
so
Paula,
much,
y muy
Maria Paula,
buenos días a
and
todos los que están
welcome everyone who's
conectados en
connected.
este
Welcome to the webinar that we
Vacunación
have called
Innovadoras en
Innovative
Vacunación
Vaccines
y
in Latin America,
Experimentación a nivel
from
mundial.
approval to impact. As Maria
Gracias
Paula
a
said, I'm Janet
ustedes,
Jija. I'm the
directora de
Executive
FIFARMA,
Director of
Federación
FIFARMA, the Latin
Internacional
American
de
Federation of
Farmacéutica e
the
Investigación en
Pharmaceutical
Salud,
Industry for
que
Research and
tenemos el
Development, and I'll
honor
have the pleasure of
de
being with you
informar
along this
el día
session
de
that we
hoy.
have today.
La vacunación es una de las
Vaccination is
intervenciones
one
de
of
salud
the
pública
most
más
effective public
efectivas y que tiene
health
muchas
interventions, and I
evidencias
think there's a lot of
científicas
figures and studies and data that confirm this,
porque
because
todos siempre
what we
vemos
all
y
see
siempre
is
menciona la
what the
Organización Mundial de la Salud y la OPS, que
WHO and PAHO
previenen
always mention, which is that
5
vaccines
millones de
prevent
muertes
between
cada
4 and
año
5 million deaths in
y
the world
son
per year.
fundamentales
And they're
para proteger la
fundamental to
vida y
protect
sostenibilidad
productivity,
de nuestras
sustainability of
sociedades, cada una de las
the health
sociedades.
system and well-being of our societies. And at the end of the day, we always have to understand
Entonces,
that
eso lo tiene
health
que ser,
has
tiene que
this
ser esa consecuencia
consequence.
puede tener más
It's
bienestar para las
bringing more
sociedades que
well-being
nos
to
están
societies that
escuchando.
we're immersed in. In Latin
Hoy
America, we
estamos
still
hablando de la
have
importancia del
important
acceso
gaps in the
oportuno a
timely access to
medicamentos
innovative
y la
vaccines.
aplicación
And this,
adecuada
at the end of the day, limits the real impact
en la
in the
población. Por eso,
population.
hoy no
That's
solamente
why we will
hablamos
not only
de
be talking about
innovación,
innovation today,
que siempre lo
which is
hacemos,
something that always
sino
brings us
de
together, but
cómo
also how
esa
to
innovación
achieve
llega a
innovation in
quienes lo
time
necesitan.
to
En
those
este
who need
webinar
it.
vamos a
In this
compartir los
webinar,
hallazgos de
we will be
dos
sharing the findings
recientes
of two recent
reportes
reports, and I think that will be very interesting
de
because we will
muchos
make
avances
available to you a
científicos
lot of
recientes.
data that has been
Uno
done
se llama Time
recently.
to Vax, que fue
One, Time to
preparado
Back,
por
which was
IQVIA y por
uh,
FIFARMA, que en estos tiempos de
prepared
acceso a
by
medicamentos
FIFARMA
de
and IQVAC.
innovación.
And
Y el segundo es el
and the second one
Vaccination
is the
Scorecard de
Vaccination
American Health
Scorecard of the
Foundation,
American
que
Health
analiza los
Foundation,
avances,
that analyzes
desafíos
the
y
advances,
oportunidades
challenges,
de
and
la vacunación en
opportunities
América
of
Latina.
the vaccination
La primera
ecosystem in Latin
presentación
America.
de este
Our
primer
first
estudio
presentation, Time to Vax,
estará a
it
cargo
will
de
be done
Oscar Virache.
by
Voy a
Oscar
leer
from IQVIA,
rápidamente
and I will
un
be
poco de la vida y
reading a little bit
trayectoria
about
de Oscar
his
Carney. Oscar Carney
biography and his life and
fue
story. He's a
profesional
professional
en
in
comercio y ciencias
trade and
con
science with
especialización en marketing y
specialization in
psicología.
marketing and psychology. He has more than 10 years of experience in strategic consultancy
Farmacéutica y en
for the
salud.
pharmaceutical industry and
Actualmente
life
se desempeña
sciences.
como
He's
Associate
uh,
Principal en IQVIA,
currently the associate principal in
especialista
IQVIA, where he leads strategic consultancy
consultoría estratégica de calidad,
globally,
evaluación
focused
de
on
procesos,
value and access,
estrategias de
pricing
precios, estrategias de
strategy,
evidencia y planificación de
evidence
laboratorio.
optimization, and launch
Entonces,
planning.
Oscar estará a cargo de esta
So
primera
Oscar
presentación
will
que
be
yo creo que va
giving
a
the
ser
first
bien
presentation that I
interesante.
think will be
Y
very interesting
luego
for
tenemos a
everyone. And then we will
Mariana
have
Rico
Mariana
de
Rico
American Health
from the American
Foundation.
Health Foundation.
La doctora Mariana Rico es
Dr.
vicepresidenta
Mariana Rico is
y
Vice
médica
President and Medical
de la
Director of
Fundación
American
Nacional
Health
Bogotá,
Foundation,
Colombia,
with a
y
branch in Bogota,
egresada de la
Colombia.
Pontificia Universidad
Graduated
Javeriana.
from Pontificia Universidad
Ha
Javeriana. She has
trabajado
a
en salud
broad
pública,
trajectory in
investigación y
public
docencia.
health.
Trabaja,
Um,
como muchos de los que estamos aquí presentes, para fortalecer el acceso a los
and
medicamentos
we work
latinos
to
y el
strengthen
avance
the
en
access to Latin
investigación,
America.
consensos
And
técnicas e informes
she's led a
especializados
lot of
y
consensus and
colaboración con
specialized
estados
reports in
miembros,
collaboration with
laboratorios, sociedades
regulatory
médicas y
agencies,
organismos
medical societies,
internacionales,
patient
apoyando la
organizations,
organización
promoting decision
basada en
making
evidencia
based
y
on
precios.
evidence in the region.
Y finalmente
And
tendremos
finally, we will
una
have a
discusión
discussion
con el
panel
doctor Luis
where
Jorge
Dr. Luis
Hernández,
Jorge
y
Hernandez,
este
and this
panel
panel
será moderado por
will
Aurelio
be
Mejía
moderated by
de
Aurelio
Asuntos
Mejia,
Públicos
Director of Public Affairs of AFIN. Luis Jorge Hernandez is an associate professor of the School of Medicine of Universidad de los Andes in Colombia and current president of the Ethics Committee of Investigation with previous experience as Director of Investigations and Area Coordinator for Public Health. He's worked at the Secretariat of Health in Bogota and consultant for PAHO. Great trajectory in the academic part. In investigation is focused a lot of his investigation in environment and health programs and models in public health, social and environmental determinants, governance of air and health indicators. He's a member of the International Society for Environmental Epidemiology, the Colombian Association of Public Health, member co-founder of ASOCEPIC, and affiliated to ACAC and Uniandinos. I hope that this meeting will be very useful, will be inspiring for everyone, can help us find the path, can help us find different connections that help us at the end of the day do what we can do. What we want to do is to advance Latin America to have greater vaccination standards for everyone. And I now hand the floor to Oscar Courtney from IQVIA so he can present the Time to Vax study. Thank you so much, Janet. It's a pleasure to be here. And as Janet commented, I'm from Australia, but I've been here in Mexico for 10 years. And we will be having translation to Portuguese and English, and hopefully from a funny Spanish, which is mine, to a less funny Spanish. And I'm here to present the results from the Time to Vax Latin America. It's a study that we started last year with FIPHARMA, and I will be sharing the results. And before talking about the results, I want to talk to you about my past few weeks, because it's been a very important and relevant week for vaccines. And he's 4. My son is 4. He goes to school here in Mexico, and we've gotten a lot of messages the past few weeks that have told us that there's 4 cases of TCR in his classroom, a case of influenza that ended up being pneumonia. And there's been a lot of concern. There's been a lot of expenses on part of the parents for pharmacies, pediatrics, the hospital. So it's been a hospital that my wife and I have seen a tangible concern that vaccines have on families, and the lack of having innovative vaccines. And in the past years, in the past 20 years, there wasn't a lot of innovation. In the past 4 or 5 years, there's a big wave of vaccine that can save lives. And there's new generations of vaccines that are more efficient, that can alleviate some of the concerns and the burden on the families. So I am going to show a couple of data on the methodology of the study and the results. This is a pilot study. This was the first year, so comments are welcome, of course. We want to hear from your questions and comments, so from there we can go and start building on this space for future editions. And I want to show you the current landscape of access and availability of vaccines in Latin America, and with time we will be able to show the evolution of it. And this methodology, some might recognize from the weight indicator study. We're in our 5th year, and it looks like, in the way that we show the results, it has been adapted, the methodology has been adapted for the reality of vaccines. And the sample has 15 years of innovation in vaccines that were approved from 2010 to 2025. And it covers 12 countries in Latin America that you can see here down below. You can see the flags: Argentina, Brazil, Chile, Colombia, Costa Rica, Dominican Republic, Ecuador, Guatemala, Mexico, Panama, Peru, and Uruguay. The sample covers 29 innovative vaccines, If you want to understand a little bit more about the selection criteria, you can find them in the full report. But basically, here on the left, we can find the diseases that we're seeking to prevent and the distribution of the vaccines. A note here, we're including Beyfortus, which is a monoclonal antibody that is used for the prevention of DCR, and the other ones are considered vaccines. And the rest is how we treat and use this molecule. A couple other notes, a study was done based on data from IQVIA, public data that is available, as well as in collaboration with the laboratories of these same innovating vaccines, and FIPHARMA and local chambers, pharmaceutical chambers from the different countries involved in the study. So there's been several rounds of validation and refining. And now this slide is very important because these are the colors and definitions that I will be repeating along the presentation. So here we can see vaccines that are not approved, which is something that is not subjected or is in process of regulatory evaluation. Second category is self-pay. So meaning it's paid out of pockets. It's available in some countries. However, if you don't want to obtain the vaccine, it's not covered by the national program, but the consumers have to go and pay on their own. Third category, it's availability in the private sector, meaning that there's insurance coverage or through employers. There's coverage also under certain schemes. The last two categories are public limited and public full. So public limited means a vaccine that has a recommendation, it has coverage at a specific national immunization program, but it doesn't follow the therapeutical use approved by the regulatory agency, meaning there are certain restrictions. It can also be the case for some vaccines like dengue or others that are covered in certain regions. However, it's not covered in the entire country in the same way. And the last category is national coverage that is public and it's full. So meaning it follows the therapeutic use and it's available for most of the population through these programs. Now, what questions are we exploring through this study? The first one is, how long does it take for innovative vaccines to be approved in the country, locally? How long? How long does it take? Time availability after approval was an area where there's limited data and we don't reach enough data to analyze. However, we understand that this takes even longer than approval, the regulatory process. Second question is about the availability and status of availability. What is the status? How much availability is there of new vaccines? The third one is availability in time. How does it evolve? What is the maturity of the availability of these vaccines in Latin America and in the countries that we have included? And finally, we have also explored what are the differences between different types of vaccines. So let's go and take a look at the results. Very briefly, the time of approval is long, it's fragmented, and there's been significant delays for access to innovative vaccines in the region during the past 15 years. There's significant inequalities between countries, and in the same country, there's important gaps between approval and availability that we see. Third, we have seen that along the years, these systemic delays have been important. However, in the past years, through PAHO and through efforts by different governments, we have seen a couple of improvements in the access. However, there's still a lot of challenges that persist. And however, there's significant differences between different types of vaccines. The ones that are for new diseases, that in the past there hasn't been a lot of innovation in the past 20 years, or that there's been it's just a new disease that can be prevented by vaccines. There is more access versus incremental improvements in vaccines. Now, taking a regional perspective first, you can see on the left, all the way to the right, we have on the left the total sample of vaccines that are available in the world. 29 in our sample that are available in countries in Europe, in the States, and in other parts of the world. When we see in Latin America how this is translated, 20 of them, meaning 70% approximately, have been approved in at least one country. At least one country. When we observe availability beyond regulatory approval, if it's covered, being a private or public, goes down to 19, which is 65%. And when they're included in a national immunization, a program, 16, meaning almost 55% of vaccines in at least one country are covered, but there's significant differences between countries. This slide shows the average time for approval in the region. We can observe here the average of the region is 41 months, 3.5 years. Immunization programs. And as you can see, it's a very long time. There are significant delays that we observe in the region with our sample of innovative vaccines. And here you can see significant differences also between the countries, with Mexico being having the lowest average, which is close to 1.5 years. And here at the bottom, Peru and Costa Rica, which are almost at the 5-year mark each in their approval time in the country for a new vaccine. This slide shows the status of availability of innovative vaccines in each country. I can see this in detail when you can see this in detail when you read the details of the report, but I just want to highlight a couple of important areas. On the left, we see Argentina and Brazil, and what we can observe that with this red point here and here is that most of the vaccines approved in the region are also approved in these countries. However, a greater number of approvals doesn't necessarily mean a greater availability for patients without them having to pay out of pocket for the vaccine. There can be an important gap between the approval, which is this red dot, and coverage in the public sector, which is equivalent to almost half of the vaccines, for example, in Argentina, are available out of pocket, subject to availability and other restrictions. Similar to the case of Brazil, where less than half are available in the public sector, even if they are approved by the regulatory agency in the country. Here we see a similar effect in Mexico, and there's other countries where this gap between approval and availability isn't as broad. However, there's less vaccines available and less approved in total, reducing the number of options that the patients have in these countries. Third, we see here the time for the global launch. So vaccines that were launched globally in a country, for example, in Europe or maybe in the United States between 2010 and 2013. Then 2014 and 2017. Now, other vaccines that have more time in market, it's not a linear trend between more time in market and more access, or broader, what's a broader access in the market. It's not a linear trend. The ones that are 10, 11 years old or a few years less. There's still important gaps between approval globally, or the global availability, and availability in Latin America. This means the ones that are available globally, and this bar represents here the ones that are available in Latin America. It's not just a matter of time, it's just a matter of priority and funding and access in the region. We see some effects, and we're showing the differences between vaccines and the reason why this. I'm going to go very quickly through this, but you can observe now with the approval times, we see the difference between new vaccines treating a disease that wasn't preventable with vaccines, or that in the past 20 years had a significant advance, or new coverage of serotypes versus vaccines against the same illness, but that had an increase or an improvement in efficacy, immunogenicity, etc. We see a very clear trend represented in the countries. The blue point that we're observing in Brazil represents diseases or an improvement in the vaccine, or not a new disease. And this time of approval is longer than new diseases, new vaccines, or new serotypes. And this effect is funny because for a new illness or disease, we would expect, to have a longer process in terms of regulatory complexity and in terms of the reduction and assessment of the data presented. However, we see this trend, and it probably reflects matters of priorities in the country and access to funding. When we observe this at access level, I know there's a lot that's going on in this graph. In essence, it's the same graph that we saw before, comparing new vaccines or new coverage versus improvements. And they improve the efficacy of a new generation of vaccine. And what you can observe here is that the level of access relative to the number of vaccines is lower for improvements in vaccines versus new vaccines. In the middle, in half of the countries, there is an effect that is significant. And finally, I wanted to close with some of the improvements and some of the positive areas that we have observed along the study. Again, vaccines are innovative. 7 are currently available through the revolving fund of PAHO. And starting on 2024, there were a couple of inclusions that were notorious. However, regardless of the fact that they have this price negotiated by PAHO, these 7 vaccines, what we can see is, even though there's this level of procurement, when we see how many countries have access to countries with these prices that are very accessible, in one country at least, we see that they're all available. But when we see availability in 3 of these countries that are using the fund, only 5 out of the 7 vaccines have been bought by the fund, but only 2 of these vaccines that are available through the fund are available in all the countries in our sample that could have access to this price, at this price. So we see a disconnection between the amount that has been negotiated, or the value, the cost, in PAHO, and the implementation and the access to these vaccines in the countries that can have access. In terms of time, it's variable, but we've seen lately a couple of vaccines available through the fund in time, and highlighting here RSV, which was included in close to a year negotiated in versus times in Europe and other parts of the world. And as a recap, the time to approval has suffered significant delays along these years. In terms of availability, there's significant inequalities between countries and in the same country between what's approved and what's available. All the time we've seen improvements, but we'd like to see those improvements being disseminated even more so. And there's important gaps between previous and new generations of vaccines. And now a couple questions to keep exploring are here. And thank you so much. Here you can download the report, and here you have my contact information in case you have any questions or comments. I would love to hear this from you. Thank you so much, Janet. Thank you so much, Oscar. Great information, great figures. They're showing the landscape of the region, the challenges that we have, but also we're showing the positives, and it's about being able to show a very clear landscape. And since we have another study to present and then a panel, I want to hand the floor to Mariana Rico from America's Health Foundation to present the second study that we are planning to present today. Mariana, the floor is yours. Thank you, Janet. Okay, thank you so much. I first of all want to thank FIPHARMA for this space to share the results of our study, which is the Regional Vaccination Scorecard for Latin America, and also to open and have this space for this conversation on vaccination that is so relevant right now, that the country is going through right now. So it's, as Janet mentioned, I'm Mariana Rico, Medical Director of America's Health Foundation, and I am here from Bogota. Next, please. Before we start, I'd like to show you very briefly who we are at AHF. America's Health Foundation is a non-for-profit organization. We're based on Washington, D.C., but we have people throughout all of Latin America and other parts of the world. And we've been working for 15 years, mainly in Latin America, with the objective of generating local evidence developed by Latin American experts to facilitate decision-making based on evidence, and that they are decisions with evidence adapted to our context, and also we try to promote dialogue and multi-sectoral collaboration between the different stakeholders of health. So we work with medical societies, with ministries of health, with civil society, and with the industry to be able to try to have these multidisciplinary perspectives. I'm going to tell you a little bit about the methodology of this project. We did an analysis of the vaccination programs in 8 countries in Latin America with the objective of better understanding which ones are the challenges, the gaps, and the opportunities that these programs face. The analysis, as you can see here, included Argentina, Brazil, Chile, Colombia, Ecuador, Guatemala, Mexico, and Peru, and we wanted to have a vision that was complete on how we adopt vaccines in the region and how we have structured and implemented the different national immunization programs, and what is the political context that is regulatory and operational also that surrounds the programs and affects their operation. So the scorecard analyzes 17 indicators of the PNIs, and each indicator was scored from 1 to 5 based on a defined rubric, and then later it was weighted based on its relevance to obtain a composite score over 5. And we can see all the details of the weights of the indicators in the report that's already published. So we have that indicators are grouped in three main domains. The first one is the scope and coverage of the program. Second is governance and public policy. And third is operation and management of the program. So, as I said, you could go into the report of the study to look at all the indicators, the detail of each one, and the weights in the scorecard. The information that we use comes from official records from the Ministries of Health, databases of PAHO, WHO, and UNICEF, scientific publications that are international, and also many come from the countries and the literature. And we also held some work tables in each country with expert groups from several sectors to validate the information, analyze them in the local context, and formulate recommendations that I will be presenting. And to mention some limitations in this study, the data availability in the countries is inconsistent, especially in vaccinations of adults and maternal. So this, of course, impacts on the analysis. And as we were seeing with Oscar, the inclusion of the vaccine in the calendar doesn't always guarantee its effective access. So we can have that a vaccine is included, but the access and coverage is completely different, as will see later on. So the availability of information on funding of the programs and the execution of the budgets in many cases wasn't complete. And then finally, this is a methodology that was adapted to the region. So it may not capture all the local nuances, and that's why it was fundamental to have validation with experts at country level.
And our goal with this work is that it's not just a diagnosis, but a tool for actions that improve access to the vaccine. So we have been able to present the results from several countries in the ministries and technical entities. And the idea is to have an annual update of the data to see progress. So let's start with a bit of context. And we know that, as Janet said, the vaccine has been one of the best achievements in public health, and that's also true in Latin America. And they're the most cost-effective interventions. We can even compare them to access to potable water. But the region has certain vaccination programs that are very diverse in structure and maturity. So we have countries that have programs like solid legislative frameworks, a long trajectory, very stable structure, and many others that are fragmented or that depend on the decisions of the current governments or external or outside organizations. And through all the programs, we find a consistent pattern that you're going to see, we're going to develop throughout the presentation, which is that the programs are highly oriented to pediatric vaccination. Advancement in vaccination throughout the course has been limited in many countries. And so we see that the vaccine in adults and pregnant women and many times in teenagers has been one of the structural weaknesses of many of the countries. We also have a perception of the population, as well as many other decision makers, where the vaccine is mainly for children. Of course, we know that what vaccines the children need, there's campaigns, there's songs even for people to remember what are the vaccines that the children need, but the same strategies do not continue throughout life. So this generates this blind spot for the rest of the age groups. And we also see what we could call a paradox of success in the programs. So historically, the region has had a culture of vaccination that's very strong and has allowed to control many illnesses, and that people in general accept the vaccination. So when reducing the perception of risk, then they have also been reducing the coverage since 2016, even before the pandemic. And we've had these outbreaks of measles, as Oscar has said, the syncytial virus, and remind us of the fragility of advancements that we have. And this also in addition to the resistance to the vaccine, which the world shows. And we're also seeing that in our region as people have more access to the information and also to misinformation as well. So finally, the region is demographic transition, less children, more adults. So this increases the load and makes it essential to implement a new attention model throughout the course of life that addresses those demographic changes that the countries are having. Next. So going to the results of the study, for time purposes, I'm going to show you the regional results, but you can go into the report to see the each of the countries where there's an analysis of the results, the individual results of each country. So as you can see here, the scores vary between the countries, and at the regional level, they have 3.5 over 5, and we could see that it identifies clear. The majority of countries have a solid base in terms of legal, robust frameworks with the advisors that work towards the improvement. Well, in some countries better, in others worse, but it exists, and there's technical guidelines that are defined. Second, the coverage is unequal. So, as Oscar said, we have not just different unequal coverage between the countries, but within the same countries as well. And depending on the population, we see that the pediatric vaccine is very strong, especially in Chile and Colombia. However, coverage with adults and pregnant women and teenagers seems to be low. Now, third, funding. And many of the countries are facing budget cuts that are not enough to maintain the programs, and there are important limitations in the information system and for maternal and adult populations. So, of course, with coverage and surveillance, epidemiological surveillance that we have. So we have structures with good bases, well designed, but the implementation limits the potential of the programs, and that's where we find the biggest opportunity. So we're going to see some results by age group, and this is one of the strongest points in the programs. All of the countries have a broad calendar. Chile and Colombia are consistent in their achieving 90% plan in the majority of the pediatric vaccines. However, several countries have not recovered fully their coverage after the pandemic. So there's even some that have shown descending curves before the pandemic. So Brazil has made a huge effort and advanced in the recovery of this coverage, but Argentina, Ecuador, Guatemala, and Mexico have required certain efforts directed to strengthen these programs and to achieve the goals. As far as certain diseases, the VPH in this case, they are included in the calendar, but it's a very varied coverage. Chile, Ecuador, and Peru show very good performance in coverage, but the rates are well below and the averages. And here we see the influence of cultural beliefs, misinformation, myths, and cases that are related to this vaccine, and low perception of risk, essentially in men, where this vaccine is available for men in many countries. So the priority in this group is to recover this in children and to establish these platforms in youths and community programs. And this is going to be key to advance towards the elimination of cervical cancer. Next. Now, speaking of maternal vaccines, we have a very important opportunity here to protect the pregnant mothers and newborns. And many of the countries we assessed include influenza, COVID-19, and other vaccines for pregnant women. And for syncytial virus, Argentina and Colombia offer this vaccine. And we have monoclonal antibodies for young newborns. And Chile uses the monoclonal vaccine, and Brazil also implemented this for pregnant mothers last year. And one of the major challenges that we have presented in this group is the lack of reliable coverage data. So with this information, or without this information, it's difficult to plan, execute, and the adjustment of the strategies that are implemented. And in many countries, the data that we have for vaccines are not updated or not complete, and or they don't have all the vaccines. So in the opportunities we have to integrate the vaccine in the prenatal controls and to involve OBGYNs, nurses, social workers, anyone who has contact with the pregnant mother that could be giving these recommendations, and that the recommendations are consistent through the various professionals, including the midwives as well. So the professionals, the health professionals, could also be a barrier for this vaccination. So, and also to strengthen communication directed to pregnant women so that they know what vaccines are needed and that they are empowered to ask for their vaccines. And as I said before, to improve the collection and quality of the data that we have for the coverage. Next. So here is the vaccination for adults, and this is where we find one of the biggest challenges for all the countries. Vaccines against influenza and pneumococcus are included in some countries, but countries like Colombia, Brazil, and Ecuador are only offering it for high-risk groups. Also, the vaccine against herpes zoster and the syncytial virus are not included, and they are available. And this is an expense that is important for the people who want access to these vaccines. The coverage data we have are very low under the goals, and we have the same problem as the maternal vaccination, but more accentuated, which is the data are not reported consistently. And in many countries, the goals are measured in a way that is not representative of all the population. So we could have a report of influenza coverage of 90%, and we are only looking at 30% of the adult population, and that gives us a representation of the real coverage. So to solve this has to be a structural change to focus on the life course with specific budgets, epidemiological surveillance, and strategies aimed at this population. Also reducing the opportunities, the lost opportunities for vaccinations, and with the service models, and strengthening the roles of health professionals so that the physicians and nurses know what vaccines are needed and make an active prescription thereof. Marina, I'm going to ask you to stop here because we have 15 minutes more and we still have a panel and a study. And so this has incredible information. So I know that you still have a couple of slides left, but then this is very important on the topics that we have for vaccinations and whatnot. So there's more regulatory frameworks and whatnot, and parents are aware of this. So they have the life cycle until to adults, and I'm so sorry to interrupt, but we have to take advantage of Dr. Luis Jorge's interventions, and we can have a couple questions at the end for you and Oscar, and then leave all the over 200 people connected to have information for you so that they can reach out to you if they need to. So really thank you so much for this part. And then you can have the panel. I'll hand over to Aurelio Mejia, who's going to moderate the panel, and also Dr. Luis Jorge and Oscar to be able to make this last part of our webinar. Thank you so much.
Gracias, Janet. Muy buenos días para todos, para Mariana, Oscar, Luis Jorge. Muchas gracias por acompañarnos, por la excelente
So thank you all, and it's a great summary
que nos muestra
of this program, and
realmente hemos avanzado, pero sin duda con grandes brechas, en
with
particular
these
con
gaps and these breaks,
estas vacunas
these
innovadoras que
innovative
actualmente
vaccines that we have,
tenemos disponible, pero con
we
muchas
have many,
brechas
many
en
gaps in the
adopción.
region.
Y sí,
And if we
precisamente
review the
nuestro día
topic
aún
of the
con
life cycle,
muchos
there's
retos,
many
desafíos
in
de
terms of
acceso.
coverage and access.
Precisamente
And
retomando un poco estos
with
últimos
these last
mensajes que nos
messages,
comentaba Mariana, quería empezar
I wanted to
con
start off with
doctor Luis Jorge, un poquito justamente esas brechas, esas
these
diferencias en
differences in
acceso a vacunas
access
a lo largo del
throughout the
ciclo de
life
vida,
cycle
embarazadas,
are,
adultos mayores, y teniendo en cuenta esa
and considering
transición
this
que muchos
epidemiological
estamos
transition
intentando
that we have,
navegar, esas
we have
brechas,
these
esas
gaps and these
barreras,
barriers
esa falta de acceso por
of
mismo,
access. What
complicaciones que en
implications do
términos
they
de
have in
carga de
terms of
enfermedad
the
y de
load?
costos para los sistemas
And
de salud. Entonces, Luis Jorge, adelante.
so please go ahead. Thank you very much. Thank you, Dr. Janet and Dr. Mariana Rico, and in the panel. And the cost of this is the increase of the morbidity and mortality, and the ICUs are full of senior adults that are, for example, not vaccinated against COVID-19, for example. Influenza coverage in Colombia is less than 30%. The vaccine against pneumococcus is not included. And so coverage could be under 20%. So the increase in death and mortality is that focus of the life course in vaccination. What does it imply? It means to have these vital moments and to integrate them, and the model, the health model, and we have the PIPE groups and immunization groups that are not incorporated, and groups that are there in their whole life, and maintenance routes for senior adults. And so windows of opportunity using the categories and coverage and control and maintenance, and they could be less than 10%. So the cost of all this is very high. So if we have these endemic values in senior adults, they're very high in ICU and same as hospital care. So the social cost and cost by or the information by the National Health Institute in Colombia 3 years ago was published in an event, and in all the cases of mortality by COVID-19, over 60 years of age, 90% was not vaccinated or did not have the full doses of COVID-19. So we went down, and there's an integration of the vaccination and immunization and the attention model in primary care. We still have a model. We still haven't done it yet, but we are paying the consequences of mortality by this requirement.
Gracias,
Thank
Luis
you.
Jorge. Una pregunta que
And a
quisiera
question I'd
hacerle
like
de
to ask
pronto a Oscar o
Oscar and
Mariana.
Mariana
Oscar, de manera
Oscar,
general,
in general,
esas
these
diferencias
differences
entre los
in the
países y
countries
sobre
and
los
in the
tiempos que
times
nos
that you were
mostraba,
showing
más
uh,
de 3 años y
over
medio en promedio,
3.5 years on
y el
average,
hecho de
and
que
the
cerca del
fact that
55%
55%
solamente llegaron a
would
alcanzar
not be
esas
enough
coberturas totales
uh,
públicas
for those
de
public
la
coverage
región,
in the
está asociado
region would
principalmente
be
a temas
associated to
regulatorios,
regulatory
de
affairs or
financiamiento, cuestiones de
financing, or
implementación.
what
Y esos
exactly?
mismos
And these
factores te lo
controls,
preguntaría, Mariana,
Mariana,
porque
I
también
would
también
ask
pensando en el caso
in
específico de la
specifically in the
vacunación
vaccination
en
in
adultos o
adults,
maternos. O sea, ¿esos
these
factores están quizás
factors
más asociados a
would
esos
be, would
elementos?
they be more
O
associated to
entonces,
these elements, or
Oscar, adelante.
Oscar?
Muchas
Thank you.
gracias. Yo
I
creo
think
que muchas
many times
veces el
the
financiamiento
financing
se ve como un
is
cuello
like the
de botella,
bottleneck,
pero
but
no en
not
todas
in
las
every
circunstancias.
circumstance.
Esa es la parte
This would be
importante.
the important part
Cuando
when
se alinea
it is
sobre el
aligned
valor
on the
de la
value of the
vacuna,
vaccine
la carga de
and change
enfermedad
of
en un área, en un
illness in one
país,
area of the country
en
to
una
another for
población,
a population.
el
The financing
financiamiento puede ser de
could
los
be
pasos más
one of the most
acelerados y
accelerated
más
steps and
fáciles.
easiest
Cuando hay
steps when
fondos ya
there are funds
asignados, hay precios
allocated,
negociados,
negotiated
hay
pricing,
alineación
alignment
sobre el
on the
valor.
value.
Cuando eso
When that
pasa, y no
happens, and it
siempre
doesn't
pasa,
always
pero
happen,
cuando eso
but when it
pasa,
does,
ya hay
then
otros
there's other
temas.
topics.
Y depende de
And
la
depending on the
población, lo que
population
acabamos
that we
de
just
ver, que es
saw,
en poblaciones
these
de
are
adultos
senior
mayores, a
adults,
veces la
and sometimes the
implementación y
implementation
la motivación y
and
el
the
awareness y
awareness and
conocimiento
knowledge
puede ser
could
una
be
barrera
an important
importante.
barrier.
Y en temas
And in
regulatorios,
regulatory
hoy en
issues
día hay un
nowadays,
paradigma donde
it's
la FDA en Estados
with the FDA in
Unidos
the United
ha
States, it's
generado mayor
generated more
incertidumbre.
uncertainty,
Ahora
and
un
now
proceso
the regulatory
regulatorio
process
puede
could
verse
be
con
seen
mayores
with
retos.
higher, bigger
Pero
challenges.
me interesa
So
lo que dice Mariana. Sí.
this is well, I would be interested to hear
Sí,
what you guys have
yo
to say
estoy de
about it.
acuerdo
I agree,
y creo
but
que
mostly
es un
it's a
tema
topic of
definitivamente el
definitely
financiamiento, pero también de
financing, but also
prioridad porque
priority,
hay otros
and there's
factores
other
también.
factors as well.
Entonces,
So
lo
the
único
only
que
thing that I
agregaría al
would
tema
add to
de
this topic on
financiamiento es
financing
que
is
cuando
that
hablamos
when we talk
de
about
vacunación, no solo
vaccination, not just
tenemos
we
que
just
pensar
not
en
have to talk about
presupuesto para comprar
budget
las
to
vacunas.
buy the vaccines, but
Toca
also
también que haya
there has
presupuesto
to
para
be
que
a
la vacuna
budget for the
llegue
vaccine to
efectivamente al
come
brazo de la
into
persona.
the
Tiene que
person's
haber
arm. There
inversión
has
en
to
todo
be
el
an investment in
proceso,
the whole
entonces
process,
logística, cadena de
logistics,
frío, recursos
cooling
humanos,
chain, and
capacitados y estrategias
so
de comunicación
strategies
efectivas para
of
que sea
effective
un
communication
proceso completo. Entonces,
for
muchas
a complete
veces
process,
vemos que
and
los
we
presupuestos
see that
tienen
the budgets
recursos
have
para la
uh,
compra de las
resources
vacunas,
for the
pero no
vaccine, for
para
the
todo el
purchasing,
resto de
and not for the
de
rest
la cadena que
of
implica
the
llevar la vacuna al
chain
brazo de la
to
persona que
take it to the
necesita.
arm of the right
Eso
person.
como primer punto.
And this is the first
Y
point.
creo que también,
So,
como decía el doctor Luis Jorge,
so
la
what I said
atención
to
del
Luis
adulto es
Jorge, the
fragmentada.
attention
Entonces, a
of the
diferencia
adult
del
is
niño que
fragmented,
tenemos controles periódicos y
and we have
seguimientos
clear
claros dentro del
follow-up in the
sistema,
system.
el
So
adulto sano casi no interactúa con los servicios y
the
cuando
adult
sí hay
doesn't interact with the
contacto,
services, and when
muchas
there's
veces no
contact,
se
sometimes they don't
aprovecha la
take advantage of
oportunidad
the
para
opportunity to
vacunar.
vaccinate.
Entonces,
So
aquí es donde se
that's
vuelve
where
muy
it becomes
relevante
relevant to
incorporar la
incorporate the
vacunación de
vaccine
manera
in a
sistemática en
very
el modelo de
systematic way
atención
in
y
the
que los
care model,
profesionales
and
de
that the health
salud sean
professionals are
proactivos
proactive
en la
in
formulación
their
de la vacuna.
use of the vaccine.
También los
And
factores
also
culturales, pues que se
the
hagan
cultural factors where
estrategias
you
de
have
comunicación para
communication
combatir toda
strategies
la
to combat all the
desinformación
information
que hay.
that is needed.
Gracias, Oscar. Mariana. Fernando, tenemos ya unos cuantos minutos.
So
No
we
quisiera
have a
darle la
few
oportunidad
minutes.
de
I'd like
también,
to use the opportunity
viendo
uh,
este
to
panorama
talk
macroeconómico
about this
regional,
regional landscape.
¿qué
What
recomendaciones
recommendations
daría
would we
usted
have
a los
on the
comités nacionales
committees
de
and
vacunación en la región
the
y a tomadores de decisiones?
decision makers?
Porque, como
And
mencionabas tú ahorita, muchas veces se deja
this
esto como responsabilidad
is left
de
as a
estos comités o de los
responsibility
grupos que
uh,
lideran los planes de
of
inmunización, pero
the
no
ones that
se
lead
tiene quizás
these,
una perspectiva
but it
más
has to be
amplia.
a broader
Entonces,
perspective.
pensando un poco
So,
en eso, ¿qué
what
recomendaciones
key
clave daría tú
recommendations would you
a
give
estos
to these
comités,
committees,
pero también
but
a los
also to
tomadores de
other
decisiones,
decision makers,
llámese ministerios, llámese
whether it
Congreso
be
de la
the
República,
Congress of the
etcétera?
nation or etc.?
La
The
recomendaciones, yo
recommendations, I
pienso
think,
que están
are
en la
in
misma
the same
información que acaba de
information
mostrar
that
los
was
colegas. Fíjense que cuando
stated by the
Mariana
colleagues when
mostró
Mariana mentioned
quiénes países están en
which
rojo, en
countries
maternas y
were
en
in
adultos,
red.
a mi gusto diría
Then,
esa aparte adultos
apart
mayores
from
de como
the
tal,
senior
están
adults,
en rojo la
most of
mayoría.
them are
Y yo
in
sé que
red,
las
and
maternas
these mothers go to prenatal control. Even in Guajira, Colombia, coverage is 50% for prenatal care. In Bogota, it's higher, 90%. But 90% means almost 4,000 or 4,500 pregnant mothers do not have this coverage. So for influenza, it's 50%, half in Bogota, and we're going to vaccine with VCR. So we are in debt with this life course. And so what recommendations do we have for the national committees? Well, Aurelio is asking, this is very clear. It's not enough to improve the coverage, but also with 2020, 2023, there's a full scheme of coverage, but to implement these strategies, establish subnational goals, clear goals, is very important in the territory. And we saw with my colleague, Rodrigo Rodriguez, how the United States is green, but they have a measles outbreak because it's an added value to the rural population. There's a Black population, indigenous population. So this is, or these are second dose indicators, and the vaccination, etc., should be broadened in their composition and coverage for patients, more participation, and industry. Industry is part of these in the United States, but private enterprises are very important in the pharmaceutical industry. The management of this vaccination is very important from micro planning. And we have the modernization law in Colombia, and these countries have their immunization and modernization laws as well. And so the role of CNPIs is very important, and this is the governance of the vaccination and the financial coverage as well. The cost of the vaccines is not guaranteeing this, and this is an anticipated purchase. For example, the OPS or Pan American Health Organization, or there's part of this that is in the national committees, and maybe it's like a decoration. So they have to validate, and they have a true governance, and as well. Well, thank you very much for all this, for this opportunity to speak.
No sé si Oscar Mariana, en 30 segundos, algún
Oscar
mensaje
Mariana, any last minute
final,
messages?
y ya
And then we
damos
can
cierre
close
a este
this panel.
Continuamos con Janet.
Well, just wanted to add that we have to continue with dialogue between the players in the ecosystems, the public, and also part of the adults. This is a very important aspect that will help in the future, because with our demographics, it's a very important focus to implement the strength in pediatric vaccines that we have in Latin America. Well, I would add to convey a message of urgency. If we see the demographic transition that we are living in Latin America and the illness load, which is evolving, it's necessary to adapt the programs to that reality and to evolve in the way that we are addressing the vaccines in both the regulatory context and the clinical context. Thank you all. Janet, thank you, Aurelio. 11:00. We are closing. It's always a challenge, and sometimes it's sad to not give enough space to everyone that we would like to see, but there's many messages, a couple of studies that everyone who's working here in Time to Vax and the scorecard, all the studies have very important data related to access. And this is just an outlook to all the countries in the region where we have work to do and other topics where finally we do have to do more work. I love the messages from Dr. Luis Jorge, lots of messages, the regions, not just in Colombia, but also there's differences in the Latin American regions. So it's noticeable. It's not the same to talk about the main cities or capital city than any other region in our country. So that's an important message. And we have to go back and review the mechanisms to help bridge these gaps, which are important. Dr. Jorge mentioned these mechanisms, but something Luis Jorge mentioned, and Oscar as well, is we have to be sitting at the same table to find a solution. No single actor can achieve this. We all have to work together. It's in our hands to work comprehensively and in an integrated form to answer the challenges we have. And thank you all from FIFARMA. We are offering bridges, platforms for this to continue. So thank you all, Oscar, Luis Jorge, Mariana, to make this happen. Thank you all.
Bueno, buen día.
Gracias.